I'll be talking about the analysis of rhetoric in medical journals. So, medicine is defined as the science and the art of dealing with the maintenance of health and the prevention, alleviation, or cure of diseases. Because of this, there are a plethora of subfields. The overarching style of medical review papers is somewhat somber. We are, after all, dealing with the pain and suffering of others. The tone of the journals are very specific, very professional, and are persuasive yet impersonal. Most of the journals are suggesting the change of a certain treatment or the improvement of a drug over another drug. People don't want to hear your personal opinions. What they want to hear are facts, results, and how this is going to help people. The format of medical journals is as follows. There is a title page. This title page has a list of authors, institutions, as well as their corresponding addresses, keywords, and a word count. An abstract defines the overall approach to the existing problem. An introduction shows the shortcomings of these existing reports, the aim of the study, and the scope of the studies. Methods and materials show the study design, the full description of methods, statistical analysis, a full description of the materials, and how the patients were given ethical considerations. The results is set up in the manner of a presentation and shows the correlation of the data. Finally, a place is left for a discussion. What did the results tell us? What are the advantages or limitations of the study, as well as what are the author's recommendations for improvements of the study, and what the author suggests would be the best treatment. Piensa Twice is an article that came from the journal Cognition. This small excerpt really shows the importance of methods and how you set up an experiment. This section is actually 14 paragraphs long, and the details were very specific. I only chose this one paragraph because I thought it laid it out in a very specific way. As you can see, they use specific numbers to define each section, such as 2.2 and 2.21 for method. So the overarching idea of Piensa Twice is that people cope better with loss when it is given to them by the main person, or namely the doctor. For a long time, people have received the news of the loss of their loved one or news that a surgery did not go as planned through an interpreter. And it turns out that when people receive bad news in their own language, they cope with it better than through an interpreter. So my second article is called Getting Past Getting By, and it comes from the Medical Journal of Pediatric Medicine. This article does a great job of really showing an author's recommendation. He's trying to recommend the CHICOS program. The CHICOS program would be a new curriculum given to residents, giving them an opportunity to improve their Spanish language skills. This would protect the patient's safety and quality, although approaches may vary. A key aspect ensuring resident language competency is needed in every training program. The author is really trying to push his opinion, but he is remaining impersonal. He's not showing, I feel this, I feel that. He's backed it up with evidence in his discussion, and now he is giving his recommendation. This is also kind of a longer paragraph, and so I just picked a little excerpt. My final article is describing physician language and fluency. This one came from the Journal of the American Medical Association. I really like this article. The title page breaks it down, the sponsors and contributions of the specific study about the performance of bilingual doctors. This disclosure about the funding received from various organizations proves and shows that they did not have any influence on this paper. This is where we received our money. We are identifying that these are the groups that wanted us to do this study about physician language fluency and how bilingual abilities affects physicians' performance. but we are saying that these sponsors did not have any role in the preparation, review, or approval of our specific paper. So they're really trying to stay unpersonable. They're trying to stray away from thoughts that they have a bias, or they are doing this for a specific reason. So rejection is very common among medical review papers. Often publishers will think that an article is not relevant, that the paper is incorrectly styled or typed, or that they have an unjustifiable conclusion. You need to meet certain standards. You need to have a certain amount of proof. You have the burden of proof. You have to prove that you have proved a better way, an improvement on the status quo. There is also a review bias, which is sometimes very difficult to overcome, that doctors or people that are reviewing your specific journal don't like your idea, and they don't want to publish it just because they think that the status quo is better than it is. And this is becoming less and less common. Works cited are also done differently under medical review journal. It's in the American Medical Association citation, and these are my citations for the different articles that I showed you today. And it's just a really interesting way to write journals. It's something very different from maybe sociology or other things, because you really are trying to prove that you are improving the treatment of someone. This makes it very impersonal, makes it very, I guess, somber in tone. But I really enjoyed reading these 3 articles, and if you'd like to learn more about them, you're welcome to go to the different links on these articles and read about the studies.